Hello and welcome to this week's edition of Health Talk. Now, today is day 51 of the national lockdown in South Africa and day 16 of level 4 in response to the COVID-19 global pandemic. Now, coming up on the program today, we'll be joined by the SG in the Department of Health in the Eastern Cape, as well as the Free State's MEC for Health, to talk to us about the situation on the ground and the plans that they have in place in their provinces to deal with the COVID-19 pandemic. We'll also hear from Apostle Mohau Rammile, who's a pastor from the Global Reconciliation Church in the Free State, who got infected with the virus and has made a recovery. He talks about his journey with us. That's still to come. But first, our senior producer, Zama Buthelezi, will take us through the latest global and South African COVID-19 numbers. Zama, good morning.
Good morning, Peter, and good morning to the viewers. As of the 15th of May, globally, according to the World Health Organization, as the world with positive cases, we're standing at 4,347 cases. And new cases at 79,187, and sadly so many people have passed on, 297,241 people. That's many people, Peter. Let's look at the South African stats, and these are as of the 15th of May, which is yesterday. At least 421,555 cases have been conducted in the country. Positive cases still growing, Peter, rapidly at 13,524, as you can see. But the department is very happy with the recoveries at 6,083. Sadly, 247 people in the country have since passed on due to COVID infection, and we still have 7,194 active COVID cases in South Africa. Now let's take a look at the provinces, Peter. The big metros are problematic. The numbers are growing, Peter. You look at the Western Cape at 7,798, Gauteng at 2,210, and the Eastern Cape overtaking KZN at 1,662. And the Premier recently, David Makula, Gauteng Premier, saying the hotspots in the province are shifting, Peter. The virus is now moving from the suburb to the densely populated townships, Gauteng, Soweto, Alexander, and others. Let's look at KZN, Peter. We're standing at 1,482 positive cases. Free State at 151 cases. The MEC will be here to talk to Peter about what is happening in that province. Mpumalanga at 67 cases. Let's move to other provinces. Limpopo, we're standing at 57 cases. Northwest at 63 cases. Northern Cape at 34 cases. So government, Peter, continues to advise all of us to observe lockdown regulations. This is very important, and to also take precautionary measures. Wash your hands with soap regularly, use sanitizers with 70% alcohol content, and wear a mask when leaving your house. And please, no sharing of masks. Also, the same mask that you've been wearing, wash it with soap after use. And also, we are advised to stay at home and only go out if you have to go to work. Those are essential service workers, or to the shops when you have to get essential stuff for your home. Also observe social distancing. It was disturbing to see people at SASA just standing there with mothers of babies. So also we need to make sure that we keep ourselves and others healthy and safety. Back to you, Peter. Thank you so much.
Thanks so much indeed, Zama. Those statistics are quite sobering now. Sadly, all too often, the statistics can feel like just numbers, but each and every one represents a real person. And this morning, we pay tribute to one of them. The Health Talk team remembers Dr. Clarence Mini, who chaired the Council of Medical Schemes. He passed on from COVID-19 related complications. Dr. Mini was a guest on this show on Health Talk. He'll be remembered for his struggle for quality and equitable healthcare and playing a leading role in the struggle for HIV prevention and treatment. May his soul rest in peace. Now, remember, you can also be part of the show by asking our guests some questions that you might have that are on your mind, or simply share your views and your thoughts with us about some of the things that we'll be discussing. And that number to call is 011 714 6841 or 6842. 011 714, that's Johannesburg, 6841 or 6842. All right, so we actually have a question for you that we'd like you to think about as well. And you know that we've been on level 4, I think it's 2 weeks now. So the question really is, and we asked this last week, but you've been at it 2 weeks now, has the easing of lockdown to level 4 made lives easier for you in any way? Particularly perhaps when we consider access to healthcare facilities in your communities. Has your life improved as a result of going on to level 4? You can share your thoughts with us on social media as well, using our Twitter handle, hashtag SABC Health Talk, hashtag SABC Health Talk, or at SABC Health Talk. Or you can also go to our Facebook page, and there you'll go to SABC Health Talks. And also, please don't forget, you can send us your voice notes or your video messages via WhatsApp. And our WhatsApp number is 065 862 4548. That's 065 862 4548. Try and keep those messages under 30 seconds if you can, so that we can get through as many as possible. I'm Peter Ndoro, and Health Talk continues right after this. Welcome back. You're watching Health Talk on the SABC News Channel. Now, the outbreak of coronavirus globally poses a major risk to those living with HIV and AIDS, who mostly depend on life-saving antiretroviral drugs. South Africa has an estimated 7.7 million people who are HIV positive, and some are struggling to access health facilities as a result of lockdown regulations.
A daily struggle for many as they battle to access medication. They are sent from pillar to post. They live in fear as they are not supposed to skip medication. But this is beyond their control. 38-year-old has been on medication since 2015.
I came to the clinic after I finished my medication, and the sister said I must get my medication immediately and also gave me prescription for the next date. However, the receptionist refused to give me my medication and said I must come next month. I can't cope every time I remember that I should be taking medication, and we are told we are not supposed to skip any medication, but they don't give us medication.
A call not to neglect patients on chronic medications, but rather incorporate the fight against the old pandemic with the current.
Part of South Africa is to reach the 1990 strategy, because the national strategic plan says that. But our worry is that after post-COVID-19, we will be back where we were in terms of stigma and discrimination that is around HIV because of people not being able to access their medication.
The Department of Health says patients should not be sent home without medication.
We are taking COVID-19 very seriously. It is a global pandemic. We want to make sure that our patients who've got comorbidities do not come into contact with COVID-19 anywhere else. That's why we say let them stay home with their supply of medication. Because should they be in contact with COVID-19, with these comorbidities, they will be in trouble. They will die quicker. So we are making sure that they stay at home with their supply of medication.
Meanwhile, the Positive Action campaign has also raised concern that people responsible for HIV counseling have been taken to do coronavirus testing and screening, and this adversely affect their services. Makhala Masiteng, SABC News, Bloemfontein.
All right, so let's stay in the Free State, and this is a province that's seen a steady increase in the number of infections since its first COVID-19 case. There are now 145 cases, 6 deaths in the province. The Free State is ramping up its COVID-19 screening campaign, and the screening campaigns have been extended to public areas such as malls and shopping complexes. To take us through the province's state of readiness, we're now joined by the Free State Health MEC, Motseng Tsiu. Thanks so much indeed, MEC, for joining us. So welcome to the program.
Thank you, Peter, and the viewers at home.
All right, so are you happy with the state of play at the moment in terms of being prepared for what looks like is going to be quite a significant peak for all of us across the country?
Yes, we are prepared. Although we are still going on getting improving on the facilities that we want to admit our patients in, we are ready because we have been told that there is going to be a sharp increase, especially now that we are in the flu season. But we are saying we are praying for the best, although we are preparing for the worst. We are getting enough beds that will be ready for us to admit our patients should they need admission. And we also are preparing enough beds for for quarantining those that would be suspected that they may have the coronavirus. So we are indeed getting ready. We are getting even the equipment that is ready, the PPEs that should be enough for our workers, because we do not want to expose our workers to COVID-19 and then they find themselves infected. Then they cannot do the work because they are our frontline workers. We need them healthy so that they can take care of our patients and do the work that they are doing right now of tracing the contacts and also taking care of the ear.
All right, so at what stage are we in terms of managing and finding people? Have we moved past just screening? Are we ramping up the testing as well?
Yes, we are indeed ramping up the testing because remember at first, when we started, we looked at the issue of your history of traveling, whether you've met people that had traveled outside the country. Now that we are concentrating on the local transmission, we have ramped up the testing. We're not just looking at the people that have just traveled or people that have met people that have traveled outside in the countries where we are having a lot of people that are infected. The local transmission has now shown us that it's real and it's there amongst our people. So at the moment, we have already tested in the NHLS laboratories in the Free State, 17,974 people have been tested, and we have screened over 1 million, that is 1.3 million have been screened. We are still continuing with the community screening, mass screening. What we do, once we get a positive patient at a certain location, we move our teams to the location to go nearer, to go and trace and find the people that might have been infected in that area.
Mangaung was a major concern at some point. Is it still an area of worry for you?
It is still an area of worry for us. Many of the patients that we are getting now, the cases that we are getting positive now, they are in Mangaung. And even the people that have counted, that we're saying they've died in Free State, they are in Mangaung. The fact that we are still getting new cases, it does not matter if we're still getting the less number, but for the fact that we're still getting positive cases on a daily basis, steadily growing, that is still a worry for us because one person can infect many people. So you still need to find those contacts of the people that are testing positive now. So Mangaung is still a worry for us.
So I've seen a significant jump in the numbers of people outside their homes once we went to level 4, increased traffic patterns and movements. I'm just wondering now in the Free State, in terms of compliance, are you getting people following the regulations, following the rules much more?
Not really. Maybe one can say one thing that I've seen that people are taking serious is the issue of wearing of masks. But in as far as the social distance and staying at home, no, they are not. There are many people that are visiting the malls that are, you'll find people walking in the streets. So they are not really following the rules, and we are really worried. And even in the malls, they would not be standing far away from each other. They'll be very close to each other, no social distancing at all. So we are really worried because we are now saying even in the malls and also the transport, the public transport, those are the two issues that worry us, that we are going to get the increase of the numbers once then we go to a lower level 3, especially here in Mangaung.
What do you think could be the problem? Is the message not getting through about just how dangerous this virus is? So what is it?
I think the message has not really got to the people clearly. Maybe some people believe when they see somebody they know having been affected by this illness. At this point in time, people still take this as not a very serious issue. They don't really believe that they can get in danger to an extent that they can die. They don't believe it. So that is what I believe it's the case. And I think from our side as the department, we must up the education, community education. Our community health care workers, as they do door to door, we encourage them to not just screen, but also educate the community about the COVID-19, because it looks like it has not really sunk in.
All right, so we've talked about Mangaung and the metros we understand already just by the sheer numbers is a risk area, but talk to us a little bit about what's happening outside towns, because the Free State is a mostly rural province, isn't it?
Yeah, the other rural province, the rural districts, like Thaba Mofokeng, it has got nine people now, and it is also growing. And Lejole Puza has got 6 for the mere fact that it stayed at 7 for a long time. But once we go to level 4, they are now 9, and we are still getting new people there. And Lejole Puza now it's at 6. Harip, which is the most rural district in the Free State, now has got 2, and our Fezile has now got 5. So we're still getting positive cases in this other district, but they are not going as fast as Mangaung is. Because in Mangaung, you'd get 6 positive cases in a day.
All right, so one of the things that we've been telling citizens to do is wash hands regularly. And the rural areas in particular have struggled in terms of access to water. What are you doing to mitigate this lack?
The rural provinces, districts are struggling with water. But what we are doing, we are working together with the municipalities to ensure that they take water to the people and they make sure that there is water available to the people. The place where we had real problems with water was in Kwakwa, so that was solved, though it's not 100% solved. We're still getting people that get water with the jojos that are taken to them. People want to get water, running water through the taps, and the municipality is working hard to make sure that they achieve that, because without water, people would not be able to wash their water and then be able to prevent getting infection. So we really are working with the municipalities, because we have told them that we have told them, and they also know that water is an essential part of prevention of COVID-19.
We saw some issues with some of the health facilities in KwaZulu-Natal recently. Has that been an issue in the Free State at all, or you've been able to manage and contain the virus as far as keeping the hospitals relatively clean?
In as far as the public facilities are concerned, I think we're doing well, because we have done our best as in trying to make sure that we give our people the personal protective equipment. And even though it's not enough, we are still ordering more so that we augment it, so that we have everything. And the other thing that we're going to do is to make sure that our occupational health teams are working in all the facilities. That would make sure that they screen our personnel, and so that none of our personnel get infected. They also screen everybody that comes into our facilities and triage them, so that whoever present with the symptoms of COVID-19 is then guided to which door she can get in and get help there. The other issue is we are having problems when it gets to private facilities, but that has been solved. The private facilities, there was an issue of when people have tested at their facilities, they would not reveal that to us. We would hear that from other people until we went to them and showed them that that is going to bring problems to the province. Because if the person tests positive and we do not know as a department, we won't be able to trace the contacts of that person. But ever since we spoke to the managers of the private facilities in the province, they have now understood the importance of ensuring that we work together in trying to manage the COVID-19, and they are reporting, because we have the people that would be able to trace. They don't have. So we are helping each other in the sense that we said, please report so that we are able to trace the contacts to stop the spread of the infection. But I think we are getting there. We have understood each other. And the problem of the personnel that have been infected, it has always been in the private sector, not in the public facilities.
All right, we're hoping in a short while to speak to Apostle Rammile, and one of the things that he's going to talk to us about is stigmatization, and he went through quite a lot when he came out and said that he was COVID-19 positive. I'm just wondering, as a department, how are you managing to start to spread the gospel of destigmatizing this virus, because it's going to affect somebody that we all know, if not ourselves directly?
It is really a big problem, a big issue in our province, the issue of stigmatization. And it's even worse when it's done by some of our workers, who would then take the issue of positive cases to the social media. It is true that the stigmatization is a problem that we have to also focus on. When all of us must focus on ensuring that we stop the spread of the infection. Now the problem of stigmatization is real. It's real, and it exists. The people that take patients' issues to the social media, they are really not doing a good work, and we are going to deal with that. Whoever has done that is going to be disciplined, because we don't want. There's an issue of patient confidentiality. You can't then go out and talk about the patient's status on social media. That is not good at all. So we have trained our personnel. We've made sure that they know that patients' information cannot be taken out on social media, because now you are violating the patient's rights.
But how do we change societal attitudes towards this? Because stigmatization often speaks to assigning blame, and you don't do something naughty to get COVID-19. And how do we educate our people to understand it's like getting flu?
Yeah, I think, like I said, the issue of educating the community has to be up to. We need to make sure that now, even our education material, the flyers that we are taking out to the people would be talking about COVID-19, so that people understand how people get infected and how this COVID-19 is spread, so that they can stop blaming people as if somebody has done something wrong to get COVID-19. Or if you are infected, somebody infected you deliberately. That is not the case. People must understand And another thing that we must make sure that we teach our people is to know that you can get COVID-19, be treated and get well. There are many people that have recovered. And it does not mean once you tested positive with COVID-19, you're going to be positive for the rest of your life, and then you're going to be infectious, because that's what people do. They now, anybody that has tested positive, they don't want to relate to that person, they don't want to talk to that person, or even the children of that person to play with their children. So there's a lot of education that we need to do, either through the media, through the pamphlets that we would produce, but we need to make sure that we deal with that. Other people are afraid even to come to the test because of the very issue of the stigma.
All right, talk to us a little bit about people that recover, and what we don't hear a lot of conversations about is reinfection. Is that something that we need to be careful of, that you've gone through the virus and the disease, because we're going to see more and more people recovering? They also need to carry on being careful, right?
They also need to carry on being careful, because we do not have an exclusive information that once you have had infection, you are now immune. That has not been the information that has come exclusively there. It is still being researched whether a person can get an infection, get healed, and then after that can still be reinfected. That is an information that is still being researched. At the moment, we cannot say, no, you don't have to take care of yourself. Everybody must take care. Whether you have been infected before or not, take care. That is why the reason why we say everybody must wear a mask, so that I do not infect other people and other people do not infect myself.
All right, MEC, we're going to have to leave it there, but thank you very, very much indeed. And we wish you and your department the best in taking care of our citizens in the Free State in the coming days. Thank you so much indeed for your time.
Thank you, Peter.
All right, so that was the MEC for Health in the Free State, MEC Motseng Tsiu, speaking to us about some of the efforts that they've put in place to try and manage and contain COVID-19 in the province. But in the end, actually, it's all down to you and I, what we do. In fact, we all have to protect each other, and that's the only way we're going to be able to manage this. All right, if you were listening to that conversation, you'd have heard me say that I've been looking forward to this conversation with Apostle Mohau Rammile, who founded the Bloemfontein-based Global Reconciliation Church in 2003. In the midst of this global coronavirus pandemic, he tested positive for COVID-19 after attending a church gathering at the Divine Restoration Ministries. He joins us now on the line to share his story of getting infected and also recovery, and as well as hope, I think, and spreading awareness. Apostle Rammile, thank you so much for joining us. Welcome to the program.
Thank you, Peter.
All right. I think we kind of know where you got the virus. On the day, do you remember how? And just to give us an idea of how easily these things can spread.
Peter, it's a very interesting thing. I attended this conference on a Tuesday, the 10th of March, and then I did a prayer session for about 30 seconds, and then there was a man before me and there was a man after me. And in that conference, it's a well-known thing that there were 5 people coming from overseas that really came into our country, and they were positive. They tested positive. I met one of them the following day in the morning. I was introduced to one of them. And then the pastor also that was hosting the whole event in their church. Also, later on, he told me that he was positive, but I don't know at that particular time he was already positive, or because of all of us in that conference that came into contact with those individuals, that ended up being positive. I think they had something like about 60-something people after the conference, after the testing, that were positive. So I believe it was an on-contact. And or because there was an aircon I was sitting under, as people are coughing or people are sneezing, that's why now we have to put masks. At that time, there was no emphasis of the mask. Yeah, so I think it was whether it was just the small, minute particles hanging in the air and or the contact that I had with one of the people.
All right, so take us through your journey. The conference ended, and then what happened to you? When did you start feeling symptoms, and what were they?
The first symptoms, it was on a Thursday. I attended the conference on Wednesday morning, and then on Thursday there was this loss of taste and and loss of smell that I was not aware. But as I was eating, something happened. But I had also a general malaise, a weakness that I experienced on Thursday night. That means the 13th and 14th. But on Friday night, I said to my wife, I'm not feeling okay. And, I think on the 14th, that's when I realized that definitely I'm not okay. I started to cough. It was a mild cough, but, you just think that you've got a common flu. The whole thing of coronavirus, you don't think about it until on the 19th, that is the first day the following week, when we got an SMS that says that 5 people tested positive, and then we needed to go and do the testing. And then I must say that, I failed the screening test. What does it mean? Is that when I arrived there, they were not willing to test me because I just presented with one symptom, which was cough, which was obvious. But the other symptoms, I forgot about them. I had them, but I just forgot when I went for screening. But I emphasized, I really forced them. I showed them the SMS that they say that when you were in contact with someone who was positive, you need to test. I tested on the 19th, and then on the 22nd of March, 8:23, my doctor called me in the evening to say, your results are positive. It took me almost about 10 minutes to run through my mind the possibilities, and I'm a leader, I'm a pastor. How many people I will have come into contact with? You just spoke with the MEC of Health just a few minutes ago. That particular Sunday, the MEC was in our church service. She came to observe the precautionary measures we had, because I met her a few days earlier, and I said to her, look, we bought the thermometers for temperature. This is what we have. We have sanitizers. Our medical team came together. At that particular time when I brought the team together, I was really positive, but I was not even aware that I'm positive. So I told my wife, and then on the 23rd, I decided to go on self-quarantine so that I should not have a contact with everybody. My wife had to go for testing. The children were screened. They did not have to go for testing. And then on the 25th of April, let me say on the 22nd, my doctor told me that I should not contact anyone other than my family. I must wait for the department to contact me, because they will have to do some screening for those that I came into contact with. I waited for them on the 23rd, 24th. They didn't contact me. On the 25th, early in the morning, they contacted me to say, we need to screen everybody or test everybody who came into contact with. I said, no, it's fine. Then I made a voice note that went viral, where I informed our members that I tested positive, and I'm in quarantine, and also they need to come and test. And that particular day, which was the 25th of March, we need everybody to come, and then also on the 26th. So at 4:30, the 25th, our church members came to be screened and tested, and also on the 26th. In the meantime, on the 23rd, when I started to go on self-quarantine, that particular night, it was the most difficult night, because the symptoms now were really, really strong. I experienced tightness of my chest, where my breathing started to really go away, and then we have what you call the heavy man syndrome sitting on your chest. So breathing was very difficult, and I had a very severe headache. It was very, very bad. That is that day when I thought, really, this is it, and this is over. I have come to that place of facing now the coronavirus. So the 23rd and 24th, they were very difficult days for me. From the 25th, when I made the voice note, I was much better. And in the afternoon of the 25th, my doctor called me to say, look, it's your 14th day based on the fact that you probably fell sick from the 12th and 11th, so you can go. But I decided to stay 21 days. The reason being, I wanted to make sure that I'm safe, It was very important. Now, the voice note went viral, at that particular moment, one had to make a quick decision to say, do you go quiet or do you go public? But by the time I got the message on Sunday night, I knew that I want to go public. I wanted to give it a face. Why? There were 4 reasons. Number 1, I wanted to deal with ignorance. Number 2, I wanted to deal with the fear. Number 3, I wanted to deal with the shame. Number 4, the stigma. I felt that the people, the initial original people that came into the country, that were 10 people that came from Italy, we don't know them. We don't know their color of skin or gender. We really don't know them. However, there are many millions in South Africa that won't have the advantage of good quality health. If they will be sick, where will they go? Who will they ask a question? As a leader, as a pastor, I felt that it's time that we must give the COVID-19 a face so that someone can ask questions. If it will have taken me down, meaning dying, it will mean that there is someone there they knew that died of it, then they can change their behavior, and then also if I recover, then there is a story of hope that it's a flu. It's a different kind of a flu, but it's a flu. You can recover from flu, so that then we deal with the fear. But at the same time, I knew that people will stigmatize me. I knew that they will attack me, which they did, and then there was misinformation all over social network. Well, I'm a leader, it comes with the territory to be criticized and to be stigmatized like that. It was okay, it was not okay. But at the end of the day, people were angry towards, I don't know, the government or whoever opened the borders. So all the anger, all the fears, they threw them on me. I survived, here I am right now. But the most important thing, Peter, is that after my voice note went viral, we released a statement as a church to confirm the voice note, and we did a live streaming to bring the face of the voice note together, and so that people could relate with my face. Then, my goodness, the questions that came on my inbox, Facebook, of people who were already, infected from the conference and other people that got infected, that we knew them as statistics, as the Minister of Health was throwing statistics. I end up getting to know the names behind those statistics to say, I'm positive also. What are you doing? How are you getting, through this? So I could communicate with people and talk to people.
All right, Pastor, you've said quite a lot, and there are people possibly now who are scared because they're coughing and they don't know whether it's COVID or not. From your journey that you've gone through, what is the most important thing that you would like to say to people now that you wish somebody had told you at the beginning of your journey?
Just go and test and get done with it, so that you deal away with the fear, and then you know what you are dealing with. You are dealing with common flu or COVID-19. Why you need to go and screen and be tested, so that you don't put your loved one in danger. I believe that it's a well-known thing that we also lost someone that I had a contact with in my office. It was not during the service this time, because during our services, the 2 services I attended, we had precautionary measures in place where all of us were tested. They check our temperature. They placed masks on our hands, and then they sanitized us. But I met him when I was still in incubation period. It means during the first 7 days, I met this man, and then there was no that much of the coughing. The coughing was there; it was mild, but it was like a common flu. I met him in my office, and as we speak, the person has passed on. And so it's better that you go and test, be screened and tested, so that then you don't pass it around to other people. So if you can self-isolate or you can self-quarantine, you can get help. And if you can't be admitted in a hospital, you will still survive. There are people who cannot afford good medical health or medical aid. You can still survive at home.
All right. Apostle Rammile, we're going to have to leave it there. Unfortunately, we don't have a lot of time, but thanks so much indeed for sharing your story and coming out, because I think stigmatization is certainly one of the big things that we're going to need to deal with in combating this disease. But thanks so much indeed for telling your story. All right, that was Pastor Mohau Rammile, who's from the Bloemfontein, and he himself caught the virus, but he's recovered and he's now preaching a gospel of educating yourself and get tested and take care of each other by wearing your masks and washing your hands and all of those things. All right, now a reminder of our question of the day. Has the easing of the lockdown to level 4 made life easier for you? And we've been at it 2 weeks now, and particularly I guess with access to things like healthcare facilities in your communities, and I see people running and exercising in the morning. Share your thoughts with us on social media via Twitter using hashtag SABC Health Talk, hashtag SABC Health Talk, or at SABC Health Talk. You can also go to our Facebook page, and that's SABC Health Talk, and you can also send us your voice notes. Try and keep them under 30 seconds long, and the number is 065 862 4548, 065 862 4548. Okay, after the break, we speak to Superintendent General from the Eastern Cape Department of Health, all about the challenges in the province. Stay with us for that. Welcome back. You're still watching Health Talk. Now, the lockdown has put a dire strain on unskilled labour and those who do odd jobs for a living in Mthatha in the Eastern Cape. The labour force claims the lockdown has proven to be a blessing in disguise, though, as it's revealed the exploitation that they've been receiving from employers. Despite President Cyril Ramaphosa announcing over 11 billion rand paid to the Unemployment Insurance Fund for 2 million workers, various workers in Mthatha claim that they've not received any payments. SABC reporter Atula Joka spoke to those affected and filed this report.
Cooking maize outside, trying to keep hunger at bay. Monday Sandita survives through odd jobs, doing laundry for her neighbors at Tabasa village in Mthatha. She lives in this two-roomed house with her husband and 6 children that include her grandchildren. The only other source of income this family has is social grants for 2 children. The lockdown period has made the situation worse for this family.
I pick up wood and sell to people. I do laundry for others. I sometimes get into the garden to see what I can get, and that is how I survive. We were called by the ward committee. I was asked to go and meet with ward committee. They took pictures, but they told me I don't qualify as I earned child support grant.
Social Development says SASSA cannot give food parcels to grant beneficiaries. However, the family will receive assistance as part of the department's social relief distress program.
One of the critical functions of the social workers is to ensure that they assess the family holistically. After that assessment, then their intervention will be both immediate and long-term intervention. The immediate intervention will be a social grant, a social relief of distress, but the long-term intervention is to identify a change agent in a family that will change the life of that family for the better.
The economic impact of the COVID-19 is also felt by those working in the hospitality industry. Hotel employees at Mthatha say they have received meager salaries end of March. These workers allege that they have not received any UIF claims and are not getting any answers from their management.
It's very hard, and I feel like a failure by working at that hotel. What will I do by earning 480 in a month? This makes me feel like a failure as a mother to 3 children.
Thule Joga, SABC News, Mthatha.
All right, so that's an area of concern in the Eastern Cape, and we're going to go there just now and speak to the Superintendent General. But before that, thanks very much indeed for the messages that you've been sending via WhatsApp. Let's take a look at a couple of those now and just see what your thoughts are. And this first one says, the healthcare service are going through a lot. If only South Africans can obey the President's rules, wear masks, keep your social distance, stay home if you're not an essential worker, maybe level 4 will be easier for everybody. The next message says there's no difference between level 5 and 4 in my area. Only the level stages, as mentioned, children are taking their kids to malls and other shops, and there's no monitoring of compliance. We only see this happening in Tshwane, Ekurhuleni and Gauteng. Even the testing of people is not happening, as I've never seen a health workers doing door-to-door screening and testing. People are moving up and down, enjoying their smoking here in Sebokeng. All right, and this one says easing lockdown from level 5 to 4 without a cure for COVID-19 was the most dangerous risk that government did, because look, today we have over 13,000 mark and only 2 weeks. Now, this means that continuing to ease restrictions, what will happen if we open liquor, cigarettes, is going to be a very uncontrollable situation going forward. And this final one says that, to be honest, I'm not going to pretend. Apart from stage 4, actually, the whole lockdown, it made my life miserable, big time. We are suffering a lot out here, truly speaking, and no one is taking that to consideration. It's easy for them to say stay at home, those who are saying so, because they're getting a lot of money. No one is suffering from their side. They must stop telling us a lot of stories. I was going to understand if they were saying stay at home whilst you're busy getting a cure for coronavirus. But instead of doing that, they're sending all these hooligans, soldiers, to beat us up, our black people, brutally, and killing them like animals. Really, I'm not happy with their operations. All right, so mixed messages are coming through. Levels of difficulty depending on your situation. If you're an essential worker, you've been working, earning money, and if you're not, then there's not much difference between level 5 and level 4. Okay, let's go back to the Eastern Cape now, where President Cyril Ramaphosa, along with Health Minister Dr. Zweli Mkhize, visited the Eastern Cape this week to assess the province's state of readiness in response to the spread of COVID-19. Despite a steep rise in the number of infections in the province, both President Cyril Ramaphosa and Health Minister Dr. Mkhize have given the province a stamp of approval with regards to the response to the pandemic. Well, to tell us a little bit more about what's happening on the ground, I'm now joined by the Superintendent General from the Eastern Cape Department of Health, and that's Dr. Thobile Mvengasha. Thanks so much indeed for joining us. Welcome to the program.
Yeah, thank you, Peter, and thank you to your viewers as well.
All right, so a stamp of approval from the President and the Health Minister. What are you doing in the face of these increasing numbers that have hit your province?
I think we're really appreciative of the minister's intervention. You'll recall that the minister had come twice to the province, and he really helped us to shape the program that we have. We have done quite a number of work where we have actually screened about 1 million people, and then we were able to test about 33,000 people, where we got this 1,569 people positive. But what really was important was that the rapid rise in the number of new infections, it meant that we're behind the curve. So the minister wanted to help us to really try to be really on top of the curve by doing basically 3 or 4 things. One, let's follow the person who is positive and make sure that the social network of the persons, we actually go and screen them, and we isolate the person that is positive, and making sure that those that have been screened are actually followed up, and those who have symptoms are actually tested and isolated. That is what is called a targeted screening and testing and isolation of the social network of the positive person. That is intended really to make sure that we have a much more higher yield and we're able to be focused and targeted. So that's one big change in the strategy. The second one was really the establishment of what is called fixed cluster teams. These teams are really attending to a bigger outbreak within the communities, mapping each one of the communities where the outbreak is going, and you follow where the outbreak is going, you follow the quantity, the contacts, and you stay in the area until you make sure that all the ramification of the new infection from an infected person is actually dealt with. The third issue was that if the person who is COVID positive must be isolated, and we work through with that team and the minister to find that we will create sufficient what is called facilities, which is our field facilities, to make sure that every person who's positive is taken out of the community so that he's no longer a transmitter. The fourth component was really to deal with a much more urgent matter that is actually coming up, repurposing the hospital beds, re-engineering for safety and quality and infection control, adding and making sure that there are very distinct lines about where the COVID patients stay and where the non-COVID patients are staying, including clear branding and making sure that the people who goes into a ward where there's a COVID patient have got sufficient personal protective clothing. And we ended by saying every data must do an end-to-end process and make sure that the life cycle of a person who's COVID positive is followed by the team until the person is recovered in 14 days. And those in hospitals, they are followed by the clinical people until they recover and go home. And those who are PUIs are followed until they go to isolation, and they're followed post-isolation and until they get the recovery. That's the essence of the strategy that the minister has actually worked with us and which we presented to the president.
All right, so it's going to get tested fully in the coming days as we start to reach that peak. Let's talk a little bit about your facilities. We saw the challenges in KwaZulu-Natal. You've gone through some similar difficulties with some of your health facilities, and I believe that there's an amount of money that's being set aside to refurbish others as well.
This is quite correct. You will recall that most of the rural provinces have facilities that were totally inadequate, even for the ordinary and non-COVID patients. So what then needed to be done was that a re-engineering and repurposing, looking very closely on the infection control. So the new designs of facilities that they've been working with Public Works, the amount of 251 million was the initial amount, which is really targeting to make sure that we've got about 2,000 beds that are repurposed from the current hospitals, and then we're going to build another what is called 300 bed unit with ICU in areas that did not have those services, and we build another 300 ICU beds. What we see is that in our projections, and this is the modeling that is done at national, is that from the bed point of view, where we're able to deal with severely ill patients, if we take the pessimistic projection, we will have adequate number of beds. Where we're doing very poorly at the moment is the number of ICU. So part of our strategy is to ramp up. We're going to build about 300 ICU beds in order to really focus and provide us with an ability to do so. The third area is that we did not have enough isolation facilities. So we are looking at about 8,000 what is called field hospitals. In PE alone, we are putting about 4,000 beds, and that will be done in the next 6 to 8 weeks. In every district, We want to build another 500 isolation facilities. These facilities are going to build in what we call phase approach, meaning that we'll be responding on the numbers, we'll know exactly how the numbers are coming up, and we will pace the way how we build this field hospital. The idea of a field hospital is to make sure that every person who is positive has a place to stay that is adequate, that is well managed, and that has got all the amenities to support the person for the 14 days. And that's really the program.
All right, Dr. Mbengashe, that's where we're going to have to leave it. Thank you so much. And we wish you strength to you, your team, and all the health workers in the province in the fight that certainly are going to be tested in the coming days and coming months. Thanks so much indeed for your time, sir.
Thank you, Peter. Bye.
All right, and that's where we're going to say goodbye to, and thank you to all of our guests actually on the program today, and to you viewers, thanks for watching Health Talk. Don't forget, the only way to manage this pandemic is if we all play safe and protect each other. Stay at home, social distance, wash your hands, and wear a mask. Goodbye everyone, have a great week. Bye-bye.